I'm Dr. David Beaulieu, and I'm back with more news you can use. And I want to talk to you today about confined animal feeding operations and some of the problems we've got with antibiotic-resistant disease that seems to be in epidemic amounts all throughout the country. In fact, antibiotic-resistant disease now kills more than 23,000 Americans each year. Wow, 23,000. That's a lot of dead people. Animals are not supposed to be confined. When they're confined, they're not happy. They get sick. You can't be healthy eating sick meat, whether it's chicken, whether it's turkey, whether it's pork, whether it's beef. Confined animal feeding operations are a mistake. They don't make sense. They're not good for the consumer. They allow us to buy food that's cheaper, but it's not healthy. And disease isn't cheap. In the long run, it's more expensive. It costs us at the doctor's office, it costs us at the hospital, and the majority of doctors today are not taking the pledge to first do no harm. Most of what we use is harmful. A lot of what we use is more harmful to our patients than the conditions that we actually treat. There are organizations out there here in the greater Kansas City area. Kansas City Food Circle is a really, really good example. You might want to write that down. Kansas City Food Circle, you can Google that. There's a lot of farmers in this area that have joined the Kansas City Food Circle. Most of them are relatively small farmers, and they grow organic fare, and they raise their animals kindly. And when you meet them and you get to know them, you know the food you're buying from them is food from healthy animals and food from healthy soil. And that's important because the soil is alive, the earth is alive. It's only when we kill it with chemicals that we start having problems. So we want to be eating food that's healthy and alive. When we do that, we don't end up with gut health problems. With grass-fed organic food, we don't have any regular antibiotics. With no regular antibiotics, we don't get dysbiosis. We don't have leaky gut syndrome. We don't have all the things in my office that we treat on a regular basis. This is really, really important. You want to eat chicken, free-range chicken, grass-fed, grass-finished beef. You want to eat pork from animals that are allowed to roam and behave the way pigs are supposed to behave, not raised in confined animal food operations. These CAFOs are frightening because they're contributing to a great deal of disease. And the people who run them are spending a fortune paying our legislators to allow them to keep feeding our children sick food. We need to put a stop to it. And the way to do that is stop buying it. Buy organic. And pretty soon, they'll go away because your dollar and my dollar are the most powerful dollars out there. Think about it.